Hi, Miss Main. My name's Heather. I'm Miss Finders. Ask me one more time what your date of birth is.
It's 1/21/78.
Perfect. Okay. So I've consulted with the doctor. We got your urine and blood results. There's no abnormalities. Nothing crazy going on there. Hormone levels are good for your age. Urine and drug screening came back fine. Nothing we should be concerned about. However, suggesting what you answered the questionnaire, it seems that you may be a little bipolar.
I'm not crazy.
Bipolar doesn't simply mean you're crazy. It means that you have manias up and down. And as we discussed it, we decided that we want to let you know that bipolar is just a chemical imbalance. You have dopamine and serotonin, which are feel-good drugs. And as we age, sometimes they drop off, and they're not as prevalent as they once was. So maybe when you were younger, you felt fine. Sometimes this happens after childbirth. Sometimes this can happen as we get older. It's completely normal. 12.3 million people in the United States are diagnosed with bipolar, so you're not alone. Our bodies are constantly changing. We just want to make sure that it's not accompanied with any other mental health issues such as OCD, ADD.
I don't have anything like that in my family.
Well, it doesn't always happen genetically. It can be environmental.
Okay.
But for us, it just seems like it may just be a chemical thing with your brain.
Okay.
So we're going to start you on some medication if that's okay.
Okay, what medication will I be taking?
That's a great question. The doctor wants you to start a Symbox, which combines an antidepressant, fluoxetine, and an antipsychotic, odozapine. It works as a depressant treatment and a mood stabilizer. So what we do is we're going to control those highs and lows, and we're going to stabilize the mood. So we're at one all day. We're not constantly feeling these roller coasters of
So
emotions.
I'm not going to snap at my kids and...
This should help. It's not a guarantee. We do many different regimens of therapy and drugs. So we're going to start you off on this. And what we're going to have you do is keep a journal. It takes 21 days for your body to naturally start forming the drug.
Okay.
So for a little bit, you might feel like it's not working, but it's absolutely prevalent that you take it every single day as ordered.
Okay.
What we're going to do is keep the journal, and we're going to document you. We'd like you to go to therapy 2 to 3 times a week at your familiarity within our practice, and we'll let you choose whichever psychiatrist you feel works best.
Does that mean that I am crazy?
No, ma'am. It just means that we believe that when there's a chemical imbalance, we can correct it and make you feel normal again.
Okay.
We want you to feel what you felt before these manias started hitting.
Okay.
And it may have never happened to anybody in your family. And maybe once we correct it and we correct the issue, we can taper off of therapy and some regimens. And we can go back to introducing normal activities and normal daily life.
Okay.
We just feel that this would be best for you.
Okay.
This number listed on the discharge is our office. It's
Okay.
the pager. It's open 24/7.
Okay.
If you feel that there's an emergency or you feel suicidal at all, please call 911.
Okay.
But if you need someone to talk to, please call this number and we'll take care of you as well. Also, it has all the information about your medication. If no one answers, like I said, leave a message.
Okay.
Do you have any other further questions or concerns regarding this?
No, ma'am. I think you've pretty much alleviated some of my fears, and I know that there's an end in sight here. I know that I will have to take the medication as ordered, and if I have any thoughts of suicide or my depression or unexplained emotions, that I should get in touch with you, and I will. I thank you very much for all your time and helping me with this. It's been a really scary time.
Absolutely. We'll schedule your therapy session starting next week, and we'll have you bring your journal.
Okay.
If you have any further questions about the medication, you call the doctor or myself, and we'll got to explain it to you further.
Okay. Thank you very much.
You're welcome.